Craig Lloyd was known as a development leader in the Sioux Falls community, building homes and more throughout the city.
He had a big heart, so he just kept trying to improve things. His thought was always that God put me on this earth to make it better. Craig was always thinking about other people, always wanted a party, liked to have the party, make the party, and sit back and watch others have a good time.
He passed away earlier this year. His wife Pat says his final days were made comfortable thanks to the Avera Hospice team.
Craig had pulmonary fibrosis, so he had been diagnosed probably about 2.5 years before he passed. So breathing became a huge issue for him, and he had a need for oxygen 24/7.
At first, the hospice team helped provide support for Craig in his home, but the decision was eventually made to move him to the Dougherty Hospice House.
It was a tough night for us. He stayed here one night, and two of the girls were up with him all night, and I found myself keep getting up and come out and check on him. I asked him if he would consider going to the Dougherty House, and I'm not sure that I had the words out of my mouth. And he said, "Oh, the Dougherty House, yes, that would be great." There's a lot of good things that have happened at the Dougherty House.
So he was transferred here, and we were able to get him a lot more comfortable. And it's nice here because family, after they've been caretakers for so long, can just be the loved ones. They can love on the patient and just be there with them, and we become the caretakers for them then.
Schumacher says they have a full team ready to create a care plan for your loved one and support them wholly, meaning physically, mentally, and spiritually.
We have a 16-bed facility. We're staffed 24 hours with nurses, care techs. We have a physician on call at all times. We have nurse practitioners here available for our patients, full-time pharmacists, social work, chaplaincy, bereavement. So we're really well staffed and able to take care of those more acute problems that people may be having.
We were able to really focus on him and not the whole medical thing, because they were there to really watch every bit of that and make sure that he was comfortable.
Being with those families, supporting those patients, to really make the most of the last time that they have together and giving them as much comfort as we can in that.
Allowing these final moments to be spent celebrating Craig and saying goodbye.
The treatment that he got and that all of us got, we were treated so unbelievable. Everything was just made to feel so peaceful, except for the party that they let us have in there too. I think the word respect just really comes to mind for the entire Avera team, from in the hospital to the doctors that were available. Everyone just really respected and honored Craig's dignity.